Greetings, my name is Elisa Bowman. I'm with Benedictine University, and I will be presenting a presentation on allergies and infection disease. Concentration HIV. Infection disease results from a number of pathogens ranging from bacteria, viruses, fungus, and parasites. Among other methods, these pathogens may be transmitted by direct human contact, contaminated surfaces, and body fluids. HIV is one of the leading infection disease in the world because of the long-term disease it causes, and this makes it hard to control. HIV mainly transmits through contact with bodily fluids, mainly during unprotected intercourse or when using needles that belongs to a HIV positive individual. Throughout today, there are many treatments for the virus. Millions of people stay infected with HIV. It is not a curable disease, but you can maintenance and maintain it. And thousands of new cases occur annually. Complementary therapy for HIV are important to enhance the quality of life and overall functioning of clients with disease will be the topic of this discussion within this presentation. HIV burden in the United States. Currently, there are about 1.2 million persons with HIV living within the United States of America. Despite advancements in the healthcare sector, some people are still vulnerable to the viruses, such as African Americans, Latinos, and the gay community. Currently, the CDC reports that 12% of people living with HIV in the United States are unknowingly infected, which hampers protection efforts against the spread of it hampers the protection against the spread of the virus. From an economic perspective, HIV treatment and management is estimated to be around 20 billion per year in the United States, mainly because of ART, which is the medication that is used to treat HIV and other health-related expenses. HIV overview. HIV targets the CD4 T cells, weakening the immune system. Continuous replication leads to AIDS. The ART, which is the medication, helps reduce the viral load. ART improves health and does not cure HIV. Omega-3 fatty acids for HIV. This is a research that was done. Omega-3 fatty acids are found in fish oils and seeds. They help reduce inflammation and support heart health. Chronic inflammation is a concern for HIV patients. Research explores omega-3 roles in lowering inflammation. They may decrease inflammatory markers in HIV patients. This was the purpose of the research is to see if it actually decreases inflammation in HIV patients. Study 1. Study 1 is a non-pregnant female HIV-infected adult that is on ART, which is the medication for HIV. This patient was randomly given fish oil supplements at a dose of 3 grams daily. The major biomarker was acute phase protein, including high sensitive C-reaction protein. Fish oils report lower inflammation. The fish oil actually reported lower inflammation related symptoms. Study 3, which was approximately 424 petitions, were involved, significantly reduced in CRP levels, indicating decreased decreased inflammation, minimum changes in the CD4 count and the inflammation immune function markers, but it did decrease the inflammation. Evaluation of omega 3 fatty acids. Omega 3 helps reduce inflammation and improves lipid levels. Studies show decreased inflammation markers, which is the CRP. No significant change in CD4 counts or viral loads. Safety profile is generally favorable with few side effects. They complement standard HIV treatment efficiently, meaning there was no interaction using the omega 3 fatty acids with the ART or any other HIV medication that was given during the time that the patient was using both. Probiotic for HIV. Probiotics are live microorganisms, mainly bacteria, that have positive impact on the human body and more specifically the gut. Probiotics are usually located in foods such as yogurts and some supplements. In regards to HIV, probiotics have been examined for the means of promoting the synthesis of normal flora in the gut of individuals living with the virus it and taking the requested or required dose. A direct effect of HIV infections and antiviral therapy, which is ART, is gastro symptoms, meaning the medication usually upsets the stomach and break down the lining or the probiotics that the body automatically makes, which is reduced. The body reduces making the floral because of the medication and the immune disorder disease. There's symptoms such as diarrhea and bloating, which reduces the absorption of nutrition. Probiotics are believed to ease these symptoms because they regulate the balance in the gut, as well as more better digestion and strengthen the immune system. Some of the benefits of this have been investigated to alleviate inflammation as well, which is common in HIV infected patients. Probiotic efficiency. This is another study two. Probiotic efficiency study number one, the systematic review and analytics of this paper includes 14 studies that documented the impact of probiotics on diarrhea and CD4 cells count among people living with HIV or AIDS. The participants receive diverse probiotics preparation with the frequency of use at 109 to 1010 of CFUs. That is the amount of the probiotics that individuals were taking, and were compared with placebo or standard treatment in a range of worldwide locations. The results of the study showed that the extended use for probiotics, that meant the use of the supplements for more than 30 days, for patients with AIDS associated diarrhea. However, there were no change in the CD4 count. There were no change in the immune system, but there were a change in the gastro symptoms. They seem not to help improve the immune functions. Some of the limitations included various variations in the strands and dosage of the probiotics, as well as difference in the study procedures. Study two. We studied this was collected by collecting 24 articles in order to assess the effects of using probiotics for HIV positive patients. After carrying out the study, the researchers found that using probiotics increased gut health while diarrhea decreased, and therefore were few serious side effects such as sepsis. Nonetheless, there was considerable in the quality of the research in the Pacific probiotic strands, which may influence the accuracy of per each patient. This showed that there is a need for more extensive and probably more stagnant research in order to maximize the use of probiotics. Basically saying more research is needed in order to prove that probiotics is a supplement used while using the ART or other HIV AIDS medications is an addition to help the patient, mainly if it works or not. Okay, this third study is conducted a random double-blind clinical trial of 30 HIV patients with immune failure. In spite of the suppression of the viral, in spite of the suppression of the medication, which is ART, in these cases, subjects were randomly divided into two groups of 15 with the formal taking 2 capsules a day containing probiotic strands in a concentration of 10 to 9 CFUs and the latter taking a placebo. Again, CD4 counts was effective after 3 months and then crossed over after 1 month without washed out period. Meaning it didn't again help the CD4 counts. It didn't improve the immune system, but it was not contraindicated with the medication ART. Evaluation of probiotics. Probiotics efficiently improve the gut health in HIV patients. That was a plus. They significantly reduce diarrhea and enhance gut microbiotic, limit impact on immune premiums like CD4 count, and is generally safe to use with minimum side effect along with the HIV or AIDS medication that is basically mandatory to maintenance this disease. Prac- Practical Omega-3 fatty acids can be used as a complementary therapy for HIV positive people, as well as probiotics. Omega-3 fatty acid supplements of 1 to 3 grams daily decrease the levels of inflammation, improve lipid levels, and mainly in patients on the ART. Again, the HIV/AIDS medication. Other emerging therapies, apart from omega-3 fatty acids and probiotics, other natural products and complementary therapies for managing HIV are also receiving attention. There is the bioactive compound derived from turmeric known as the cumin. The cumin. It helps with anti-inflammatory as well, which basically lowers the general inflammations in HIV patients. There is a bioactive compound. Oh, I'm sorry, I read that already. Demonstrated to have potential for the immune system. It is high antioxidant content and other nutrients that might help strengthen the immune system in HIV positive patients. Relaxation techniques, such as practicing yoga and using mindful meditations, are also on the rise by lowering the psychological strain that that comes with having a chronic illness like HIV or AIDS. These practices may enhance mental well being and psychosocial as well. Thank you for taking the time to endure this presentation, and comments are very well needed.